now let's take a look at this concept of the conspiracy among dentists, okay? And we'll talk about dentists because dentists are not all convinced as I am of its safety, so now I'm safe. This would involve a conspiracy of, say, 100,000 dentists. The AMA has come out and said it's safe, so 200,000 physicians, researchers, public health officials. So this is a pretty large conspiracy, okay? Usually I think of a conspiracy as being something that falls down anytime you have more than 2 people doing it. As soon as the second person, the secret's out. So now we have 300,000 or 400,000 people keeping things tight. And also, why would I not want this guy to be right? My accountant would love for me to have every patient that comes into my office need to have all of their old fillings removed and newer and better white fillings, which are going to cost 40% more, or gold, which is going to cost 5 to 10 times more. Okay, so I'm actually shooting myself in the foot by defending amalgam, as are all other dentists who defend it. He did lose his license. He forms a holistic dental referral network, so we get referred to a Huggins dentist in Tacoma. Apparently you have to fill out a form and you have to pay him a certain amount of money. You go there and then he's got all sorts of tests that he will give you. He'll take samples of hair, which has been found to be a very inexact and imprecise method of determining your body chemistries. But he takes samples of hair. He takes venous blood, not arterial blood. Makes it
Why did he lose his license?
Colorado Dental Board just started coming after him for this because he just didn't have any data for what he was saying. I've got to step this up, so let's get going. All right, so what are the possible reasons for different results in amalgam studies? Well, Elaine has gone over this, placebo effects, statistical, because they do have studies. These guys do have studies, yeah. But there's a statistical regression to mean, spontaneous remission, all the things that Elaine had spoken of earlier. Okay, 1990, he got a real boost from Morally Safer, 60 Minutes, who cited a study by a group headed up, not the first name is Filipini, where they put some silver fillings into sheep and found a greater concentration of mercury in the sheep kidneys, and now feel that this is harmful. Subsequent human studies that were replicating this mode did not find, while we do process a bit more mercury in our kidneys, we do, if we have silver fillings, it has not been found to correlate to any disease entity. So this hasn't been replicated. 8.7% of dentists wanted to ban amalgam after the 60 Minutes thing. 14% are still unsure about its use. My profession has not been trained in statistics, in skeptical thinking. We didn't I never got it in school. I'm teaching my students now about statistics, and as I was saying earlier, in the land of the blind, the one-eyed man is king. I know very little, and yet I've got to do something. So my profession is anything but a monolithic type of profession. We very much have differences of opinion. Okay, John Dotis, he's a dentist practicing in Forest Hills, wrote a skeptical response in the 2001 Journal of American Dental Association. I'm going to skip over this just to get moving. It's bad. The exact mechanism of toxicity of mercury isn't really fully understood. It may have something to do with an affinity for sulfite groups on proteins, but we really aren't sure. How much mercury are we talking about? Well, these are the guys, many studies, who find 10 micrograms per cubic meter per day. In other words, this is released into your mouth in the average person. The other group found 1 to 2 micrograms per day. These guys are the guys that are more affiliated with Vini and Huggins. These guys are not. So it's by a factor of 5 or 10, different, and it's just very difficult to measure this precisely. Okay. How do we know it's too much? The lowest observed adverse effect level and the no observed adverse effect level, 25 micrograms, 5 for general public, or 1 for children, pregnant women, and ill people. All right, so we want our micrograms per cubic meter to be 1 or less for children. This is the standard that has been adopted in dentistry now. Okay. So clinically significant effects not seen below 100 micrograms per cubic meter. All right, so that's considerably more than what they're worried about. 20 micrograms per day for lungs, 400 for the gastrointestinal tract. Okay, so in Minamata, Japan, industrial waste released large volumes of mercury into the sea. Fish, bacteria processed the mercury. Fish ate the bacteria. People ate the fish. A lot of people had mercury toxicity. These people died. They had severe central nervous system disturbances and teratogenic effects on their children. It's called Minamata disease. We are aware of mercury toxicity. We know what it looks like when it looks bad. All right. We do take effect. We do take stances against this. We're not pro-poison. But the amount of apparently ingested mercury was 5 milligrams per day, which is an amount 1,000 times greater than the amounts that are alleged to be released into our systems from our mercury fillers. I can't get to it right now, I'm just in a rush. Okay. Now, the nun study. There was a study done on a population of 2 convents of nuns between 72 and 102, eating the same food for long periods of time. Some had Alzheimer's, some did not. They were autopsied, the ones that died, of course. The others were given a cognitive test, the ones that made it through, and no relevant differences were found between any of them. What about a dentist? Urine test conducted on dentists 288 conventions showed higher concentrations of mercury in urine than the general public. All right, so we are at risk. Why? Because I'm always taking out silver fillings or putting them in. All right, so I'm at risk of ingesting this stuff, and indeed, dentists do have more mercury in our urine. However, that was not found to have any greater kidney dysfunction than the general public, even though our mercury levels are considerably higher than the general public. Okay. Another recent, so I'm almost done. 500 children in Massachusetts in a Harvard study, 6 to 10 years old. We did have a control. Half had composites, half had silver fillings. Evaluated over 5 years without any differences in psychological or renal function. A sister study was done in Portugal at the same time. A similar protocol followed for 7 years. Same results. Difference here, they report that the composite group had 50% greater need for restorative treatment or retreatment of their fillings after 5 years. In other words, it's harder to do white fillings right. They don't last as long. So these kids that were getting the beneficial thing from Huggins' standpoint had to redo their fillings shortly afterwards in a much higher proportion. In conclusion, the amount of mercury necessary to observe any effect in the most vulnerable population is orders of magnitude lower than the amounts needed for actually observed phenomena. Estimates of mercury are 1 to 10 micrograms a day, well below the levels established by the World Health Organization. Amalgam alarmists use poorly controlled studies. And several controlled, properly performed studies show no correlation between amalgams and any population. Now, one last thought. What if I have not convinced you of the safety of silver? What if you say, you know what, Spiro, this is all great, but you know, I want to hedge my bets. And what's the harm, really, in banning amalgam? Canada did it. They're nicer than we are. You know, Austria did it. You know, a lot of other countries did it in Northern Europe.
They banned it in Canada?
Banned. Tell that to them. Tell that to them. Some guy told them that they can't fill their teeth because they didn't have the money in their program to give them fillings. Now they have to have infections and they have their teeth removed. Tell that to this guy working on the street in India. Tell him he's got to have a lot of fancy, super sophisticated equipment with a suction unit and worry about doing everything just right over there in that environment to treat people properly. Tell that to these Peace Corps workers out in Tibet who are going out into the countryside. And I did work like that when I was in dental school in Jamaica, when you work on people in straight back chairs. How are you going to do something sophisticated and delicate in that environment? Tell that to our poor children. The average dentist who's in a Medicaid practice gets paid between 10 and 20 bucks for a filling. You think this guy's going to sit there and take an hour to do a filling like I do in my practice? No, they can't. They can't afford it. What's going to happen? Those fillings are going to be redone at a higher and higher rate. So the stakes are very real. They're very great. The people who are banning them are first world countries. They're not taking into account the poor of this world. Okay? This is a wonderful material. It should be kept around, I hope, for many centuries more. Thank you very much.